Welcome to another episode of our Clinical Pearls. Today we're going to be talking about congestive heart failure. Congestive heart failure is a very important topic, and we're going to talk about how to fight it and win. First, before I get to my slides, I want to just give you a quick overview. Congestive heart failure is a very important illness. It's one of the major contributors to hospitalization. I would imagine if I took a poll of the audience, at least one of you either have been diagnosed with congestive heart failure sometime in your life or know someone who has. It's probably the number one cause of death. And we're going to get into some of the detailed aspects of what congestive heart failure is. Many individuals often are confused about it. Many of my patients who come in, they were told they had congestive heart failure before. They weren't given an adequate explanation, and they think they're in dire straits. But first and foremost, we're going to explain what congestive heart failure is. Next, we're going to talk about the mechanisms by which congestive heart failure can cause illness and potentially death. But more importantly, we're going to talk about what you can do about it. Not only are there good standard therapies, there are medications and surgeries, but more importantly, there's some very simple things that you can do on your own that's so powerful that can not only help you prevent congestive heart failure, but can also help you control it and even reverse it. So I'm going to show some of the science behind this, and I think you're going to really get a lot out of it. So first and foremost, what I want to do is I want to share some information with you in terms of what congestive heart failure is. I'm going to get my slides ready to share. So congestive heart failure, how to fight it and win it. First, I want to get into the diagnosis, or I should say definition of what congestive heart failure is. And before we do that, we have to talk about what is heart disease. First and foremost, heart disease is an umbrella term that describes any condition where the heart is malfunctioning. So there are many aspects of heart disease in addition to congestive heart failure. So when we consider the normal heart function, we then need to think about, okay, in what ways can heart dysfunctioning normally malfunction? Now, let's talk about the normal function of a heart. It's like a pump. It beats about 100,000 times a day. It has two sides that we think of. There's the right heart, which is in blue. It receives deoxygenated blood from different parts of the body. It circulates it to the lung, where the blood then gets oxygenated, and then it gets returned to the left side of the heart. And then from there, it gets circulated to what we call the systemic part of the body, or throughout the periphery, the brain, the arms, the lower extremities, the abdomen, the intestines, all parts of your body that needs valuable oxygen receive circulation from the left side. Now, the heart has its own circulatory system. So as you see here, this large artery that's receiving blood from the left ventricle has its own coronary branches. So the heart feeds itself blood first. And these are called the coronary arteries, coronary standing for crown. And the large segment of these arteries sit on the outside of the heart like a crown. But there are many little tiny branches that penetrate through the heart muscle that sends blood through each cell. So you also have the electrical system of the heart. The heart has its own God-given pacemaker. It sits right up here in the right upper chamber near what's called the superior vena cava, or a major vein that feeds into the right upper chamber. And it initiates signals to the heart through the upper, then the lower chambers. Now, the sinus node, or your intrinsic pacemaker, receives information from the brain. It can also be affected by certain medications that we give it, but it increases the rate at which the heart beats. So when the heart has to beat fast, to say if you're exercising or you're anxious or nervous, you have to maybe fight someone off, then your heart needs to circulate blood faster, so the heart needs to beat faster. So what happens is that this gets signals from the brain saying, hey, we're afraid, or we're being chased by a bear, and then it sends out signals faster. Also, the situation when the heart needs to be relaxed. So if you're asleep or you're resting, the heart doesn't need to beat 100 beats per minute all the time. It needs to slow down. So this gets signals from the brain saying that, hey, we're going to sleep, slow down. So the sinus node initiates signals, and it controls the rate and, by and large, the rhythm in which the heart beats. Now, when the rate and rhythm is controlled by the sinus node, everything works well. The upper chambers contract first. The lower chambers contract second to that. And both chambers on the right and the left contract at the same time on the upper side. And the left and the right lower chambers contract at the same time on the lower side. And this is due to the fact that you have this intrinsic network, detailed network electrical wires that go through both the upper chambers and the lower chambers. You see these main electrical pathways, one on the left and one on the right, and they branch out into trillions of little tiny branches. And this sends electrical signals throughout all of the heart muscle tissue. So it allows the heart to beat in a synchronized, organized fashion. This is going to be important in some of the aspects of heart failure that we'll talk about later. So again, you have an electrical system and you have a coronary artery system or its own plumbing. So how can the heart malfunction? There are a lot of different ways it can malfunction. Many people are aware of heart attacks. So when the coronary arteries or the arteries become clogged or blocked, you can have a sudden occlusion of one of the arteries where you have what's called a heart attack and blood flow suddenly stops and heart muscle tissue dies. Depending on how much heart muscle tissue dies, it creates a large scar. If you have a large scar, the heart can then weaken. You can have weak valves. Valves can wear out by scarring. Valves could be leaky or they could be stiff where they don't open up normally. You have electrical disease. Those electrical pathways that I mentioned earlier can become damaged. They can become damaged due to heart attack or due to just scarring. And then you can have abnormal electrical circuitry that causes the heart to beat too slowly when it needs to beat faster, or it can beat rapidly and erratically. So these are different ways in which the heart can malfunction. There are primary heart muscle diseases that are contributed to by simple things like hypertension, diabetes, and other systemic illnesses. You can have inflammatory conditions like lupus or sarcoidosis that can directly affect the heart muscle, causing scarring and damage. The systemic illnesses such as infection can cause inflammatory markers to go up that can attack the heart muscle cells. You can have autoimmune diseases, and of course, substance abuse like alcohol can also cause direct effect on the heart to weaken the heart muscle. So there are many mechanisms by which the heart muscle can become weakened and therefore create, at least predisposed to, or create congestive heart failure. Heart failure is not rare. It's something we see all the time. There are two forms of heart failure. Even though we use the term congestive heart failure, and classically we've used the term congestive heart failure to refer to a heart that's dilated and weak. But there's another form of heart failure when the heart squeezes normally but is stiff. And so we call that diastolic heart failure. Diastolic heart failure, as I said before, is when the heart is stiff. So it doesn't allow for adequate filling of blood into the heart muscle. Inadequate filling results in decreased amount of volume. Decreased volume of filling results in decreased amount of volume circulated. So that results in decreased circulation and decreased delivery of oxygen and fluid to the body's systemic tissues. And so that results in poor cardiac output. The other form is systolic heart failure. Is when the heart is usually dilated, but it's too weak. It doesn't contract well. So we talk about ejection fraction. In systolic dysfunction, the ejection fraction, which is the percentage of blood that's squeezed out with each contraction, is less than 50%. Diastolic heart failure alone, you may have a normal systolic function. So your doctor may tell you that your heart is pumping normally, but it's stiff. That's diastolic heart failure. But the heart may be dilated and weak. That's systolic heart failure. In many cases, we see a combination of systolic and diastolic heart failure. In fact, the individuals have an enlarged heart that's weak, so it doesn't squeeze out more than 50% with each beat, but it's also stiff, so it doesn't allow filling. And so these individuals have a particularly difficult time in terms of their physical activity, in terms of their overall well-being. A brief word on the epidemiology of heart failure. Over 6 million adults in the United States have it. It's a major cause of death, and it's also a major cost to our healthcare initiatives. So that's something that we deal with on a regular basis. So heart failure is very expensive, so it's something that we need to get a handle on. What are the standard treatments for congestive heart failure? Well, there are many. There are many medications that are used, and this slide is a little bit outdated. There have been medications added to the indication for treating heart failure. Typically, there are medications that reduce resistance of flow so the heart can circulate. So you may be given what's called an ACE inhibitor or an angiotensin receptor blocker. There are medications such as beta blockers that relax the heart, decreases the increased rate of contraction of the heart or the speed of heart, so it helps the heart slow down and rest, so it preserves itself. And there are many other medications, and there's some antiarrhythmic medications that are given for heart failure patients, because the main two ways in which a heart failure patient will die, one is by means of pump failure, so where the heart slowly wears out and you start to go into multi-organ failure. So as the heart weakens, you get less circulation throughout the body. So less circulation to the kidneys begin to fail. Less circulation to the liver begins to fail. Plus you have backflow congestion to the liver. Less circulation to the brain, you start getting dementia, forgetfulness. Less circulation to the GI tract, you start having gastrointestinal problems, which includes poor gastrointestinal nutrient absorption And many people with heart failure can have malnutrition due to the fact that the GI tract is not absorbing food. So medications for heart failure tend to try to counter these problems, such as arrhythmias or pump failure. The second mechanism is sudden death. There are antiarrhythmic medications that can work against ventricular arrhythmias, but you can also have arrhythmias such as atrial fibrillation, which further weakens the heart. So you may be on an antiarrhythmic medication that can decrease arrhythmias, but the most important arrhythmia to be concerned with is ventricular arrhythmias, because that contributes to the second most common cause of dying with heart failure, which is sudden death. That's also treated with devices called defibrillators, which we'll mention in a minute. So, other things that can be used for treating heart failure for individuals who have severe blocked arteries that's amenable to revascularization. They can undergo stenting, coronary angioplasty and stenting, or bypass surgery. Additionally, there are devices, as I alluded to earlier, individuals with heart failure are at risk for dying suddenly. So oftentimes, if the ejection fraction is less than 35% and everything's been done to improve it and it can't be improved, individuals will be given a defibrillator prophylactically to prevent them from having a sudden death cardiac episode, and scientific data has shown that to be beneficial. Sometimes we'll start them off with a temporary defibrillator. We call that a life vest, which can prevent sudden death. But this is something that can be worn temporarily while we're trying to improve the cardiac function. There are also ablation procedures that can be done for arrhythmias like atrial fibrillation. If atrial fibrillation is successfully ablated and controlled, that may allow the heart function to improve. So there are other therapies, and of course, individuals with severe heart failure that doesn't correct with some of these other means, they have to go on to what we call advanced therapies. They're oftentimes referred to the advanced heart failure team that consider them for transplant, or a device implant called an LVAD, which stands for left ventricular assist device. So these are some of the more advanced therapies for heart failure. And many of you who are looking at this recording may have known someone who's gone for heart transplant, been evaluated for heart transplant. Many of you may know individuals who have defibrillators or the like. However, despite all of the technology, and I'm working here in the world's largest medical center as a cardiac electrophysiologist, I've managed patients at every level. I've had patients with LVADs, I've had patients with transplant. I implanted, thousands of defibrillators, biventricular devices. I've done thousands of ablations and prescribed countless prescriptions of medications. However, over time, I've seen patients, despite all of this advanced technology, get sicker over time. And so what I began doing is research on my own and found that there was an integrative medical approach that's very, very effective in helping people not only prevent heart failure, but also control it and reverse it. So let me share with you some of this information. Integrative therapy starts with nutrition. Many of you have seen any of my videos before. You know that nutrition is the foundation of the care that I give my patients. And for heart failure, it's no different. The first and foremost, like I often say, optimal nutrition begins with what you remove from the diet. So you want to eliminate inflammatory foods. These are, gluten-causing foods, casein, processed meats, meat proteins, processed sugars, the like. You want to replace them with fresh plant-based foods, foods that are nourishing and are alkalinizing to the blood, but also they decrease inflammation. Additionally, let's get into more details. If you're in severe heart failure early on, we say consume mostly raw fruits and vegetables. In fact, many of my heart failure patients, I put them on a 100% raw fruit and vegetable only detox for a period of weeks to months to let the heart recover. Over time, once you add cooked foods, then you want to do at least maybe 2 raw plant-based detoxes a year, each being about 30 days or 45 days in duration. You want to have a large variety of plant foods, different colors in your diet. You want to eliminate all processed foods, all animal products, all alcohol, 100%. There are certain micronutrients that are beneficial: vitamin C, coenzyme Q10. We use a super blue green algae. We use this in place of a multivitamin because it has many nutrients in a natural form. L-citrulline is a macromolecule that allows for the production of nitric oxide. And of course, vitamin D3. Many people are vitamin D3 deficient. One micronutrient that's missing is magnesium. It's frequently something that is missing, and people are frequently depleted of magnesium. Now, there are advanced integrative and regenerative therapies as well. So some of our very sick patients oftentimes benefit from what's called cardiac assist therapy here. This is called external counterpulsation. This is like an external balloon pump. We've treated, thousands of patients over 2 decades with this treatment with great success and outcome. Typically, we treat patients with heart failure and angina with this therapy. Infrared sauna therapy has been shown to be beneficial in heart failure patients, improves nitric oxide production, reduces blood pressure, reduces arrhythmias, and we've had great success with this therapy. Intravenous vitamin C as well as oral vitamin C. It's an antioxidant and it improves the vascular milieu, improves the vascular function in patients with heart failure. Oftentimes, patients with heart failure have diffuse coronary disease as well as peripheral vascular disease. And of course, we use ozone therapy, which is a therapy that's been around for 150 years. It's not used very much in the allopathic arena, but used a lot in functional medicine. And we've gotten great success with individuals with not only congestive heart failure, but some form of renal failure, where it halts the progression of renal failure and helps the kidneys improve. And so we've had great success with this. And these therapies, in addition to an aggressive nutritional detox regimen, can be very, very effective. So let me share with you a patient that presented to our center, and I'll walk you through how we worked her in her congestive heart failure. So this is a 72-year-old lady who had a history of what's called left bundle branch block, and I'll explain that in a minute. She had a history of hypertension and was diagnosed with congestive heart failure probably about a year and a half prior to seeing us. Her symptoms included shortness of breath with very mild activities. She had problems walking to the store, just doing simple household chores. Her husband even noticed that she had decreased energy, and we classified her as a New York Heart Class 3, and I'll explain that in a couple of slides. So what is left bundle branch block? And I mention this because she has it, number one. And number two, it's important because, as I said earlier, one of the ways in which the heart can break down is by an abnormal electrical system. Now, many patients will come to me and say, well, my doctor looked at my EKG and told me that I have a heart block. If your doctor tells you have some kind of a heart block based on looking at an EKG, it's very likely an electrical block, not a block in one of the coronary arteries. So it's electrical conduction abnormality. And one of these electrical conduction abnormalities is called left bundle branch block. I'm not going to go through the whole list of different conduction abnormalities. You can have, AV block and other types of block. But left bundle branch block is the conduction block that she has. And what is that? Well, if you look at this diagram, and what I'm going to do, I'm going to share my screen with you so you can see this diagram a little bit larger. So you can see here the sinus node, as I pointed out before, and you had conduction through both of the upper chambers on the left, and it all comes around to here, which is called the AV node. The AV node, it sits sort of more in the center. This picture is a little bit off. It sits maybe a little bit more in the center, and conduction comes from the left side to here and also to the right. And this serves as a filter, and then electrical signal then goes down to the lower chamber. This is the main electrical pathway to the left side. We call that the left bundle. And this is the main electrical circuitry to the right side. We call that the right bundle. But sometimes, for whatever reason, maybe a heart attack or due to scarring or inflammation, one of these bundles become disrupted. And in this case, the left bundle was disrupted. So there's a certain pattern on the EKG that we can look at that shows the left bundle branch being disrupted. So what happens is, when the electrical signal passes this way, you see no block conduction here. So all the conduction goes to the right ventricle. So the right ventricle contracts first. And as a result of that, right ventricle contracting first, the electrical circuitry has to go to the left ventricle through slow backdoor pathways. So the main electrical highway is cut off. However, this electrical signal goes to the right, and then electrical conduction pathways through a back door to the left. So you get the right ventricle contracting first and the left ventricle contracts second. So instead of the ventricles contracting together, synchronized manner, they contract asynchronously. Okay, so we call it dysynchrony or asynchrony. So the upper chambers contract more or less synchronously, but the lower chambers, because of one electrical pathway is blocked, one side contracts first and then the other side contracts later. This can result in a decrease in efficiency of circulating blood. So keep that in mind, because there are ways we can treat that. So let me just share with you the main way we treat that is with a special kind of pacing. So what we do, if somebody's very symptomatic, now this isn't done for everyone with left bundle branch block, but if you have heart failure and you continue to be symptomatic despite optimal medical therapy, then we will then add a special kind of pacemaker to synchronize your two ventricles. In frequent situations, we found that to be beneficial for patients who don't get better with medication or lifestyle treatment alone. So what we do, this diagram shows you have a pacemaker lead that goes in the upper chamber. That's called the right atrial lead. Then you have another lead that goes down into the lower right chamber, and then you have another lead that you snake around. And this vein here, we call it the coronary sinus. And this vein goes to the back of the heart and goes to the left. And so it really feeds venous blood from the left side back to the right. And this is the venous blood that's taken from the heart. So remember, the heart sends itself oxygenated blood, and then it takes oxygen away. And then the veins in the heart sends the veins back through the coronary sinus and back to the right atrium. So because the coronary sinus opens up into the right atrium, we're able to get to the left side of the heart through this venous system, and we can snake a little lead around, and we can snake it. If we're fortunate enough, we can snake it into a certain area where we can then pace the left side of the heart. And so you have a pacemaker lead here on the left side, a pacemaker lead there, and one on the right. So you have communication from the upper chamber and both lower chambers. And the device, the defibrillator, is programmed to time this pacing signal with that pacing signal so they're synchronized. And so when you have that, here's an x-ray. So you have the pacemaker here, and you have the lead with the right atrial lead. This is in the upper chamber. Then you have the right ventricular lead here, and then you have the left ventricular lead that snakes around here. So if your loved one has what's called a CRT device, a cardiac resynchronization device, or a biventricular pacing device, ask your doctor to show you the x-ray, and you'll see these three different leads. It's something I think that would be pretty fascinating. So here's the general approach for this. And again, left bundle branch block, the main electrical pathway in the upper chamber is disrupted. Conduction, the left ventricle comes from the right. And so you have loss of synchrony in the conduction of the two ventricles, and this can result in a decrease in efficiency of circulation. Now, the other thing I pointed out with this patient is that she had New York Heart Class 3, and we have a formal way of classifying heart failure. Class 1, you can have an abnormal pumping heart, have heart failure, but have no limitation. There are many people with quote-unquote asymptomatic congestive heart failure. So that's a New York Heart Class 1. New York Heart Class 2, you have slight limitations. Maybe when you start to exert yourself, maybe you can't run that mile as fast as you could, or if you try to climb stairs quickly, you get short of breath. That would be a Class 2. Class 3 is marked limitations. So you try to do mild activities of daily living. If you get short of breath or symptomatic there, that's a Class 3. And Class 4, essentially you're symptomatic at rest or with very, very mild exertion. So our patient was a New York Heart Class 3, so she was, pretty far down the line in terms of symptomatology. So she also had a combination of a very stiff heart and a weak heart. Her ejection fraction was low. It was at 30 to 35% on previous echo. And she had what we call as grade 4 diastolic dysfunction, which is a severe amount of stiffness. So prior to seeing us, she was advised to undergo a defibrillator implant and also increase her medications if her ejection fraction remained less than 35%. She came to us because she wanted to try an alternative approach. And so we started on a nutritional intervention. So the nutritional intervention is the foundation of our therapy. In her situation, we started on 100% raw plant-based nutritional diet. She was on a time-restricted eating period between 11 a.m. to 4 p.m. Beverages consisted of water, raw plant smoothies, or cold-pressed juices, no overly processed foods or beverages of any kind, and of course, no alcohol. She also underwent infrared sauna therapy. She came to our center. She initially started the nutritional detox at home. She was out of state. She came back to our center. She also received infrared sauna therapy, and the data of infrared sauna therapy improves nitric oxide production, improves what's called endothelial cell function. Endothelial cells are the inner lining of the blood vessels. So if those cells are not healthy, your blood vessels are not healthy. So improved endothelial cell function is equivalent to improved blood vessel function, which of course correlates to improved circulation, improved reduced blood pressure, improved peripheral blood flow. So oftentimes people with heart failure may have also peripheral vascular disease, and they may have poor circulation to the extremities. And so oftentimes they may be at risk for amputation or peripheral blood flow to the kidneys. There's also reduction in inflammation with infrared sauna and reduction of arrhythmia. So This has a synergistic effect with the nutrition as well as many of the other modalities that she received. Now, what did we find? So she came in and her B-natriuretic peptide was elevated. This is a measure of stretch. So the higher this number is, the more stress on the heart muscle cells there are. And we saw this decrease by almost half. The amount of inflammation was significantly elevated. We like to have this number down to about 1 or less than 1. It went down very significantly. The troponin, this is an ultra sensitive or high sensitivity troponin. We usually like to have this number at least around 10 or less than 10. It was 30. Hers went down significantly. LDL cholesterol did go down significantly. ApoB went down. And a pulse score is a test we used to measure. And this percentage stands for the percent chance of her having a cardiac event in the next 5 years. That went from 8.9% down to 1.9%. So again, here we have, and as I mentioned, the amount of stretch on the left ventricle was reduced by nearly 50%. Inflammation was reduced greatly. LDL cholesterol was reduced. This is the bad cholesterol. And then the decreased heart attack risk was reduced greatly as well. Importantly, also, was that the ejection fraction improved. It went from a range of 30 to 35%, all the way up to 40 to 45%. And her diastolic dysfunction became less severe. Her mitral regurgitation, that's leaking from the valve between the left upper and left lower ventricle, left lower chambers, went from moderate to mild, so that decreased. So she had a less leaky valve, and that was likely due to less pressure against that valve due to decreased vascular resistance. And so overall cardiac function improved to the point that she had an EF that improved upwards of 45%. Her energy level improved immensely. She had reduced requirements for medication, and she no longer needed the defibrillator. So she avoided extra medications, avoided a surgical procedure, improved her quality of life. And all of this was done without hospitalizations. This was done with her following a defined nutritional plan, which really wasn't that hard to follow once she got started. And we just assisted her in terms of making adjustments in medications and things as needed. What I want to share with you now is the published data that we have here. We published a case series of patients with heart failure where we put on the very similar regimen, and we saw a 92% increase in ejection fraction. There's a 21% reduction in the enlargement of the heart, left ventricular mass. There was a 62% increase in the stroke volume. Stroke volume is the amount of blood that's ejected out with each heartbeat. 17% increase in cardiac output. That's the amount of blood that's circulated around the body per minute. And one patient had a 90 to 95% narrowing, a near obstruction of one of the arteries, and this improved significantly. It went from 90 to 95% almost to zero. So here's the data here. Ejection fraction from baseline started around 22%. EF on average went up to about 44%. So these patients on average would need a defibrillator, went up to where they wouldn't need one. LV mass or thickness decreased significantly. The amount of stroke volume, blood circulated, contracted, released each time was increased, which is very important. And that correlated with an increased amount of cardiac output. And here is the image. Here you see a 95% osteal lesion, and there was no stenting or bypass. This patient just went through a nutritional intervention, and her ejection fraction went from 24% to 50%. That correlated with this as well. So again, you can defeat heart failure if you work hard. The power can be with you. There are a number of approaches that you can take on the natural side. We've treated, thousands of patients with heart failure and other chronic illnesses, and many of our patients come in not only just with heart failure. They have heart failure, renal failure, heart failure, lupus, and heart failure, and inflammatory bowel disease, diabetes, and obesity. And so they have a combination of illnesses. And when you're treating a condition as severe as heart failure, and you compound chronic illness such as kidney failure and liver failure and obesity, etc., you really need something as comprehensive as an aggressive nutritional approach and some of these other therapies that work synergistically with each other, but they also work in concert to improve the function of all the body's organs. And that's the secret sauce, I think, here. When we're treating heart failure with heart failure medications, many heart failure medications that may be good for the heart failure, but they cause stress on the kidney. And there's some antiarrhythmic medication or other medicines for the heart that cause more stress on the liver or more stress on the GI tract. So when you're treating these medically with one therapy here or there, you can only treat one condition, but you may be causing a problem somewhere else. So that's why I like this comprehensive approach of nutrition, because the nutrition treats everything. If the heart and liver and kidneys are failing, once you start the nutritional detox, all those organs start to improve in concert, and they also help each other improve in concert. So that's what I have for you today. I hope you enjoyed this. And if you like this information, give us a thumbs up and also hit the notification button. Please share this and, of course, subscribe if you haven't had a chance to do so. Until next time, take care. Look forward to